This is Operating Room 3 at St. Helena Hospital, the heart room. When no other option exists but to open the chest and operate directly on the heart, this is where it happens. Heart operations are often foreseen and scheduled, but even in emergencies, our cardiovascular team stands ready.
I was having a little bit of shortness of breath. I didn't have any chest pain.
When I woke up with a little discomfort, I still didn't think anything really major.
So they came and they put me in the ambulance and took me to the Clear Lake Hospital. Once I got there, I was really having trouble breathing.
So when I got in the ambulance and they said, no, we're going to take you to the heliport and we're going to fly you to St. Helena. Do you want to go to St. Helena or do you want to go to Santa Rosa? I said, no, I've heard so much good about St. Helena. I want to go there. I bet I was in surgery within an hour after my phone call.
I was coming down in the helicopter, and we had Dr. Sakopoulos, Dr. Hyde, and Dr. Lees all there with the gurney waiting for me to land.
We took him that night to the operating room at about 1 in the morning and performed emergency coronary artery bypass surgery on him.
I guess they operated on me for 5 hours, maybe 6 hours. I'm not sure exactly how long. It was pretty touch and go. They told me that if I had waited just a little bit longer, if it had been a little bit longer, that I wouldn't have made it.
Dr. Sakopoulos and everybody just boomed right in there. Within 1 day's time, started taking care of me. You know, not like, well, we can't take care of her for 2 weeks like somebody else did, because I wouldn't have been here.
Well, that meant a lot, obviously. He saved my life.
Dr. Sakopoulos gave me a new lease on life.
They did it. They saved my life.
When we operate, as surgeons, we use the same instruments and the same tools, the same scalpels and the same scissors that surgeons have been using for hundreds of years, really. In addition to these ancient tools, we get to use some really interesting and fun technology.
We're adding 3 exciting technologies that really help us provide the most cutting-edge care in this whole region.
To stay at the leading edge of cardiac surgery, St. Helena Hospital is investing in 3 devices critical to enhanced patient care: the latest heart-lung machine, the cerebral oximeter, and the Impella left ventricular assist device.
Heart-lung machines were developed in the 1950s. Initially, it was a crude machine that was a pump and a bubble oxygenator.
It took a day to set it up, 2 days to clean it, and took literally hundreds of units of blood to fill the thing up.
The modern heart-lung machine is a mainstay of open-heart surgery, especially in operations where it's necessary to work inside the heart itself.
But when you have to work inside the heart and perform valvular procedures, then you have to put the patient on the heart-lung machine, arrest the heart, and work inside the heart.
While the heart is stopped, oxygenated blood continues to circulate through the body, thanks to a machine which is able to replicate the function of both heart and lungs.
Going through heart-lung bypass and having an open heart surgery could be a tremendous stress to the body. The new technology gives us finesse in this process so that the brain is protected, the rest of the body is nourished during the procedure when the heart is not functioning at all.
The tubings are lined with heparin and other substances that make the flow of blood very smooth, and it doesn't cause as much of a reaction to the body as in the old heart-lung machines.
The chance to get a new heart-lung machine with state-of-the-art technology is extremely important. People wake up with better brain function, they have less problems with their lungs, and these machines are so much better. We can use less blood, and they make the ability to do these operations much safer and quicker.
The cerebral oximeter is a simple yet sophisticated device designed to monitor oxygen flow to the brain during surgery.
The cerebral oximeter is a device that uses infrared light transmitted through the skull to look at regional blood flows in the brain.
Believe it or not, we put these patches on a person's forehead and we can measure the oxygen actually inside your brain instantaneously.
One of the things that we've been unable to monitor thus far is what is actually happening in the brain. Knowledge of regional blood flow in the brain is important because despite normal vital signs, patients sometimes wake up with neurologic deficits. For example, stroke, personality changes, difficulty concentrating. We are now able to detect that and intervene before the patient suffers any damage.
I'm convinced in my own personal practice I've prevented 1 or 2 major strokes by changing something during an operation because I could tell immediately that the oximetry to the brain was changing.
The newest and perhaps most revolutionary tool to be added to the St. Helena Hospital heart program is the Impella left ventricular assist device.
It is a device that, with a little motor and a pump, takes over the action of the heart from inside the heart.
After we complete the operation, we wean patients off the heart-lung machine. And sometimes their heart is just not able to continue to beat on their own. So in those circumstances, we need an additional aid that will help the heart recover for the next several days. The Impella device is gaining popularity, but for now it is still mainly limited to big academic centers. We are the first institution north of San Francisco that has utilized this device.
Taken together, the new heart-lung machine, the cerebral oximeter, and the Impella left ventricular assist device will assure our community that St. Helena Hospital is committed to providing the best care possible whenever cardiac interventions are required.
We are very grateful to our community and to our foundation for the great contributions that have been made to our hospital for the advancement of the care of our cardiovascular patients.
The fact that the community is interested and supports us so much is tremendously appreciated.
So please be generous and raise your paddles. With your help, we can take the next step on this exciting journey.